Government across the globe, health community and civil society fraternity are very aware about the increasing problem of non-communicable diseases. However, there is still lack of awareness among the Ugandans on how to avoid getting these diseases countrywide to reduce on deaths related. According to Christopher Kwizera, Programs Manager, Uganda Non-Communicable Diseases Alliance, UNCDA, the Alliance has implemented a number of public health campaigns, community involvement, information sharing, using the media, in-person gathering, home-to-home, and supporting other community organizations with the aim of reducing non-communicable diseases in Uganda.
We have implemented a number of successful public health campaigns and programs promoting healthier lifestyles to reduce the burden of non-communicable diseases in Uganda. We've done a lot of community involvement. We do information sharing using the media and in-person gatherings, then home-to-home campaigns using community health structures like VHPs and community health persons, community health workers. And we also do support other organizations, community-based organizations, to achieve the global initiatives aimed at preventing non-communicable diseases.
Uganda Non-Communicable Diseases Alliance, UNCDA, in the year 2024, under Strategic Media and Community Engagement Project, embarked on different activities that included school outreaches to educate the younger ones to understand non-communicable diseases and how to prevent them at school and in their homes.
You have cancer of the lungs, like you say, you have cancer of the throat, you have cancers of every part of the body, even cancer of the skin, okay? Cancer of the blood. There are quite many cancers, but most of them are not transmissible from person to person. Okay? Number 2 is diseases of the heart, specifically cardiac arrhythmia. We normally call them cardiovascular disease. Cardiovascular means cardio and vascular. Cardio means the heart and vascular means the blood vessel. So the diseases that affect both the heart and the blood vessel are
you can make any exercise. Push-up is not good.
Yeah.
You can take sit up at morning. First thing, before breakfast, you can take any exercise without push-up. Another is good. Swimming is good. Sit up and you can take, you can bring running, and you can bring like table and sit like that.
We can prevent non-communicable diseases by having a balanced diet, doing physical exercises, avoid taking drugs, such as marijuana, cigarettes, and alcohol.
Non-communicable diseases are diseases that cannot be spread from one person to another. Examples are diabetes, heart diseases like stroke and high blood pressure, cancer like lung cancer, breast cancer, cervical cancer, and blood cancer.
Lung diseases like asthma.
Causes are smoking tobacco,
Drinking alcohol.
not doing regular physical exercises, having unhealthy foods. And prevention is feeding on a balanced diet,
Doing regular physical exercise.
do not drink alcohol,
Do not smoke.
prevention prevents non-communicable diseases. Your health is your future.
Further, the UNCDA held a media personalities workshop that was attended by a number of journalists discussing measures of increasing awareness about NCDs and related risk factors.
Now, well-informed and researched about emerging and trending issues locally and internationally. Do you guys specialize in journalism? What brings about the specialization? Passion?
Ministries, it is just asking myself about the ministry's maximum intervention. The maximum intervention is only put on epidemics and pandemics. You see, MPOX, the ministry called a press briefing, I think it was two weeks back, were there at the ministry headquarters, and the ministry was very serious on doing what? On stopping MPOX in the country. We always see Ebola outbreak. We had COVID-19. You saw the ministry's maximum intervention on ending COVID-19 in the country. But why is it that the ministry is not serious as such on NCDs?
Today we are undergoing a workshop of media personnel and media practitioners and comedians or arts people on prevention and control of diabetes and other non-communicable diseases. We understand and have realized over time that the media is the biggest tool to channel information, especially for education, to the population and to the entire community of Uganda. But quite often we realize that there's a lot of inaccuracies when the media is communicating, or when some people are communicating, or there's completely no information reaching down to the people, especially on prevention of non-communicable diseases. So we think and we find it prudent to bring the media people together, take them through the basics of prevention and control of non-communicable diseases, but most importantly, to give them the concepts of NCDs, so that whenever they are talking to the population, or when they are relaying their information, they are talking it from an informed point of view.
Dr. Rumu, during the media engagement, highlighted on some of the high-risk factors of non-communicable diseases.
In 2014, when they did the STEP survey, 1.4% of Ugandans, which translated to about between 600 and 700 Ugandans, had diabetes at that time. In the 2023, which was survey which was done, that number has increased to 3.3%. And if you had to put it in numbers, we have about 1.7 Ugandans with diabetes. That is almost more than twice the number that we had about 10 years ago. Now, the numbers wouldn't be, somebody who is listening to me or seeing me would say that that is a very small number when it comes to the 47 million Ugandans we have. Like Chris said, when you have 5 diabetics diagnosed, there's another five people with the diabetes who do not know. So more than 50% of Ugandans do not know that they have diabetes.
Furthermore, the Alliance held NCDs advocacy and persons living with NCDs meeting with the purpose of encouraging people living with NCDs to support each other to keep on treatment and fight the disease, and also to pool resources together to supplement medicines given to them by government.
I am a lawyer, but all my life I studied as a type 1 diabetic. So it hasn't stopped me. The only difference between me who has diabetes and somebody who doesn't have diabetes is that I have to inject my insulin and they don't have to. That's the difference. If I listen to my doctor, I share with my friends what I'm going through, nothing is going to stop me. And I know sometimes it can look bleak, it can look bad, it can look like there's no hope, but I can assure you it's not the end of the world.
Community level, at facility level, we are mobilizing people who are diagnosed and are getting treatment at health centers into what we call people living with NCD groups. And these groups have about 3 purposes. Purpose number 1, they will use them as vehicles for sensitization and creating awareness on NCDs. Purpose number 2, people living with NCD groups, is to support themselves, among themselves, encourage each other to keep on treatment so that they do not default on treatment, but also to fight the disease.
Diabetes is the major NCD in Uganda, with 6% of the population having the disease, and according to Christopher Kwizera, Programs Manager UNCDA, 1 out of 3 people are not diagnosed with diabetes. Hence the reason to why much emphasis on awareness campaigns in communities, schools and other places. Premature death from NCDs are largely caused by modified risk factors, including tobacco use, unhealthy diet, physical inactivity, and harmful use of alcohol. In Uganda, 33% of total deaths are due to non-communicable diseases, and for every Ugandan citizen, the probability of dying prematurely from one of the 4 main NCDs is 22%.
And then, if you forget about the mortality due to non-communicable diseases, generally, we know that the reading of all of these is cardiovascular disease that accounts to more than 20% of all death. And when you look at that, when you look at hypertension, high blood pressure, 1 in 4 of average adult Ugandans is living with high blood pressure. And that is close to around 25% of adult Ugandans, based on the statistics that were gathered from the 2023 baseline STEP survey, which is yet to be published.
After the major progress achieved globally in the control of communicable diseases, non-communicable diseases are today the world's largest killers. NCDs, namely cardiovascular diseases, cancers, chronic respiratory diseases and diabetes, cause an estimated 38 million deaths every year, with a large part of these deaths being premature. NCDs not only affect people's health, but they also negatively impact the socio-economic development of countries by increasing the financial burden of the health system and through the loss of productivity of people who get ill or die too early.
Non-communicable diseases not only affect the physical nature of the people, but they are also agents of poverty among our population. Once people are sick, 1, they may not be as productive as they should be because they do not have enough energy or the energies. That's number 1. Number 2, they have to visit hospitals, therefore their absence at the work is increases. But also, some organizations have actually kind of terminated people's contract because once they are chronically ill and they cannot go to the facility. Then the other issue, the other driver is the catastrophic spending. They have to spend money